here is your question. Right, so if you have read and understood, considering its surgical anatomy station, kindly identify what you are looking at on picture A and B.
This is okay. This is the dorsal surface of the hand.
Yes.
And
which
on
hand,
the
if you
other,
can identify? Which side
okay,
is
that's
it?
the left hand.
All right. Can you please look at this area over here on my right-hand side image and identify what kind of area is this? What is it called? What are the boundaries? And
Okay,
the contents, please.
Okay, that area is called the anatomical snuff box.
Yes.
It is bounded on the posterior medial aspect by the extensor pollicis longus.
Yes.
And then on the anterolateral aspect by the abductor pollicis longus and extensor pollicis brevis.
Okay. Can you please tell me the contents?
The contents include the radial artery, and then the floor
Yes.
is the scaphoid bone.
All right. Can you tell me the insertion of extensor pollicis longus muscle?
Okay, the insertion of this muscle is at the distal phalanx. The insertion of the the insertion of the extensor pollicis longus. Is it extensor pollicis?
Yes, please.
Okay, it's at the
the base of the terminal phalanx of the thumb. And if you can tell me kindly the insertion of extensor pollicis brevis, because we're dealing with the external surface, so I'm asking just a yes.
Yeah. So it is at the proximal. Is at the proximal. Why the other is at the
proximal phalanx of the thumb. Okay. Right. Yes. Can you tell me the attachment of extensor retinaculum?
The attachment of the extensor retinaculum is attached to the radial styloid process of the radius on the lateral aspect and the pisiform.
Can you tell me the structures which pass through or below the extensor retinaculum?
The structures which pass below the extensor retinaculum, they are divided into 6 zones. The first zone consists of the.
Are you sure they are called zones?
Longus.
Are you sure they are called zones? Yes.
Compartments. The first abductor pollicis longus, and then the extensor pollicis brevis. The second compartment is extensor carpia radialis longus and extensor carpia radialis brevis. Yes. The third compartment is extensor pollicis longus. The fourth compartment is the extensor indicis, and then extensor digitorum. Then the fifth compartment is extensor digitorum.
Yes.
And then the sixth compartment is extensor carpi ulnaris.
Okay, can you please tell me what makes extensor tendons attached to the phalanx or the phalanges?
Okay, they attach to the phalanges by the extensor expansions.
Okay. Can you tell me the function of intertendinous connections?
The function of intertendinous connections, they form as a connection between the two extensor tendons their function is that they aid in the extension of they also aid in they create space between the extensor tendons and they stabilize the metacarpophalangeal joints.
Okay, can you look at the image on the left-hand side and identify first dorsal interosseous muscle? Can you locate?
On the left.
On the left-hand side, the one, yes, this one. If you can identify here, first dorsal interosseous, and kindly tell me the origin, insertion, and action of this muscle.
It arises from the first metacarpal, but
yes.
I can't.
And
then it inserts at the lateral side of the extensor expansion of the index finger.
Yes, and its action is, what does it do?
It's an abductor.
Abduction of the index finger. Okay.
Abductor.
Yes, of abduction of index finger.
Yes, ma'am.
Can you please tell me the attachment of pisiform? Which tendon inserts on pisiform bone of the carpal bone?
Okay, it is the flexor carpi ulnaris.
Flexor carpi ulnaris. Good. Can you tell me, when you're doing a power grip of the hand, then what is the role of the radial nerve in that process?
The radial nerve is the main extensor of the it supplies the extensors and then gives a mechanical advantage to the power grip. So it causes a synergistic activity, which will cause more efficient flexion when you are doing the power grip.
Would you be able to explain to me why hand grip is more powerful in extension than in flexion?
Okay, it is because most of the flexor muscles in extension, they are more at attention in extension than in flexion. So contraction is more powerful in extension than in flexion.
Can you tell me the nerve supply of the dorsum of the hand, please?
The nerve supply of the dorsum of the hand.
Yes.
Okay, the nerve supply of the dorsum of the hand. There is the medial 1.5 fingers is supplied by the ulnar nerve, and then the lateral 3.5, except the fingertips, is supplied by the radial nerve.
Yes, and the tips of the
they are supplied by the median nerve. 3.5,
including the nail bed.
Including the nail bed.
Nail bed.
Yes,
okay, good. Can you please kindly tell me if you consider if you can kindly tell me right, how I wanted to ask you about the blood supply on the dorsum of the hand. If you can tell me which vessel supplies and how the branches.
Okay, the dorsum of the hand is supplied by communications. The dorsal branches of the radial artery and then the ulnar artery, they form an arc. It's a dorsal carpal arc which supplies the hand.
Okay. Once you were telling me about the anatomical snuff box, if a patient comes to you and has or complains about the pain in the anatomical snuff box, and you ask for the X-ray, and it does not show you anything, what would you advise to the patient?
I will advise the patient to get an MRI scan.
Okay, why?
Because it is more sensitive than an X-ray.
What are you trying to rule out? What are you trying to look out for?
I'm trying to look out because the blood supply of the scaphoid has the scaphoid has a peculiar blood supply to to the distal part, which is by retrograde flow. So there can be a necrosis of avascular necrosis of the scaphoid. So it's better I get an MRI.
Yes, and you'll ask first if the patient has come across any trauma, and then you'll try to find out. Okay, if we can quickly revise palm of the hand, because you said hand, so palm is also there. Can you identify structure 19, please?
19 on the right. On the right, on the left.
On the right, please.
Okay, structure 19. That's a muscle.
Is it?
Yeah, that's is it the tinea eminence?
No, it's not. Okay, can you identify 27 over here?
Okay, 27. Okay, 27 is radial artery.
Radial artery, yes. If you can identify 31 over here, please.
31 is the ulnar artery.
Very good. If you can identify 29 over here, please.
That's the superficial palmar arc.
Yes. And right, and all right. So what is superficial palmar arch, if you can tell me quickly?
Superficial palmar arc is the blood supply, which is the blood is the arc which is formed by the superficial branch of the radial of the ulnar artery, and with an anastomosis from the radial artery, which supplies the palmar surface of the hand.
Okay, thank you. Oh.